For an adult, there are few things in life more demoralizing or disturbing than having a set of terrible teeth. That is, teeth that are overcrowded, crooked, or stick out, or actually don't even meet, resulting in an over or an underbite. Any one of these situations can have a disastrous effect on one's life and certainly their self-confidence. And you know what's amazing? The older you get, the harder these conditions are to correct, which means they should be treated while one essentially is still a child by the ages of 13 or 14, before they stop growing. And the doctor you need to see to do this is an orthodontist, uniquely trained dental experts in straightening teeth and aligning jaws. Essentially, what they do is diagnose, prevent, and treat dental and facial irregularities. And trust me, it takes many years of education to learn how to do this. To discover what the world of an orthodontist is like, we've come here to the Seagirt, New Jersey offices of Dr. Patrick Cuozzo. He is a board-certified orthodontist and an artist in helping to create beautiful smiles.
We're an orthodontic practice, meaning we're a specialty practice. We do just braces. That's dental facial orthopedics is growth and development of the face. So what we specialize in is movement of teeth and development of jaws and bones the way they grow. The American Association of Orthodontists recommends an evaluation at the age of 7. Our average patient age is somewhere around 10.5 to 11. Now, what the American Association of Orthodontists is looking for at the age of 7, there are 6 to 10 malocclusions that need to be treated at a very early age, and they can be intervened and corrected. So there is a small percentage of the population that can benefit from what we call an early intervention phase. We do like to see patients at 7 or 8 years old just to see whether or not they're one of those patients. The majority of the patients that we see, almost 90% of them at that age, go on what we call just a recall. Meaning they'll come in, we'll take a look at them and say, you know, everything looks fine, the teeth are coming in the way they're supposed to. We'll just see you back, whether it's a year, 6 months, 9 months, wherever we feel is appropriate.
We wanted the best for our daughter, and Dr. Cuozzo has a huge reputation of being one of the best in the areas.
This is a big day for your daughter, really.
It's huge. It's a huge day for her. She's been an excellent patient, cleaning her teeth, keeping the hygiene, doing what she's supposed to with the little brushes, and she's been a very good patient.
This is Alyssa Palmer, and she's here today to get her braces off. She's been in treatment. She's had her braces on for 2 years. These are her preliminary photos. We take a full set of orthodontic records before the patients start. And what you can see in this picture is that her teeth do not interdigitate the way they do on this side. You can see they all fit together like teeth on a groove. And over here she had a significant overbite, so we've corrected that for her. Now you can see more of her bottom teeth, and she doesn't have the overbite from the side. So she's been in braces for 2 years, and we're ready to get her braces off today. Open really big for them, doesn't hurt, they just pop right off, okay? And you can see how easy the braces do come off. Now these are the actual braces that are bonded to the teeth. They're called brackets, and you can see that they actually get just snapped right off. Great. Okay, the braces are now off, but we have to go around and get the cement off that's on your teeth that we held the braces on with. And this doesn't hurt, it just sprays a lot of water. That's why we have everything all covered up.
Like, I feel really weird. I feel different. It feels like my teeth are really, really big.
Beautiful?
Yep.
You happy?
Yes, I'm very happy. It's really weird. I'm excited.
To get a growth change, what we call dental facial orthopedics, meaning if somebody has a significant overbite where their top teeth are out compared to the bottom like this, that needs to be corrected at a very young age, meaning it needs to be corrected while they're growing, 10.5 to 11. If it's excessive, even younger. But again, average age 10.5 to 11, because they're still growing, we can correct that. If we get to the age of where they're 16 or 17 years old and they've completed their growth, we no longer can fix the overbite short of doing it with some other type of treatment, whether it be taking out permanent teeth or whether it be actually an orthodontic jaw surgical procedure where we remove the jaws, remove the bones because they're no longer growing. So there is no real age restriction on braces. We have adults that get braces also,
Working here with Dr. Pat is like leaving your family and coming to work with your family.
I understand you wore braces yourself as a child, and I'm wondering, in this business, how does that help you in working in this field?
Well, you're empathetic to what the patients are going through. You know when you're tightening a wire that it'll be sore for a couple days, but it goes away. You also know there's an end to it and how fabulous you'll look after you get the braces off.
In educating parents, what are the big kind of questions and concerns that they have when they come in with their children?
They're very concerned on how to keep the braces clean. Because if you do not keep braces clean, then you can get scarring on your teeth, you can develop gingivitis, cavities. They're concerned about how much pain their child's going to be in. So you want to educate them on that.
It's not a big issue, is it?
No, that's exactly what we tell them, that it's mild discomfort, somewhat like a headache, and that's about it.
You want what's best for your child, and you know, being the parent of 5 children, you want to do what's right for all of them, and you know, that's why we felt very comfortable with Pat Cuozzo. He just does such a tremendous job with the kids. He makes them feel so comfortable. We have 4 children that enjoy the experience of going to Pat, and they were even kidding because you know, they miss coming to him once they're done with their braces. So he just does a tremendous job with the kids.
My parents decided that I should get braces, so I wore them for 2 years, and then I got them off going into 8th grade. And like, it was weird, my teeth looked really different. It was a good feeling, like after all the hard work of fixing my teeth and stuff, it paid off. Now I have a good smile, so.
Just the fact that you look so much better when you're done, and everything is different. It changes, you know, your whole mouth, and your whole appearance changes. So, yeah, pretty much your whole face.
Dr. Pat has been a blessing in my life because he took over the practice and has done an excellent job of bringing the practice to as high a quality as it could be. And Dr. Pat has been recognized by his peers as one of the top orthodontists in the state of New Jersey as well as the nation.
We keep a large staff to better serve our patients, meaning that whether it's answering the phones, whether it's talking to parents, whether it's providing care. I like to keep a staff that's well trained. Some of our assistants have been in orthodontics for over 20 years, are all certified in what they do, so I don't like to cut corners when it comes to providing care.
What about the impact that orthodontistry and braces and the results can have on someone's life?
Peer pressure in our society is one of the biggest things that affects a lot of the decisions that we make. When I was younger, I look back on things that had molded my life, and there was, in teenage years, there were maybe 1 or 2 people that may have made a comment to me at one point in time that I've never forgotten. So I think back to that. This is a very moldable time in people's lives that we have a chance to actually have a positive impact on them. If you're giving somebody a positive self-image of themselves, if they're not afraid of the way they look or afraid to smile, I think that really helps. And again, I just find that it's a very nice thing. It's a nice profession, and you see a lot of happy people when we're finished.
A look at the critical role an orthodontist like Dr. Patrick Cuozzo plays in the field of dentistry today. I'm Doug Llewelyn, reporting from Seagirt, New Jersey.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.